Hi everyone, I am Dr. Gopal Purohit. Today we are exploring a topic that may seem complicated but is truly fascinating. That is tyrosinemia. Stay tuned as we simplify it for you in easy to understand rare genetic disorder, and don't forget to hit that subscribe button if you enjoy learning new things with us. So, what exactly is tyrosinemia? It is a rare genetic disorder that affects how the body handles an amino acids called tyrosine, which is found in many of the food we eat. When someone has tyrosinemia, their body cannot break down tyrosines properly. Normally, our body breaks down tyrosines to get it ready to be removed as waste. But in people with tyrosinemia, this process doesn't work properly, and tyrosines start to build up, which can be harmful. There are three types of tyrosinemia. Each one is different based on what part of the tyrosines breakdown pathway is affected. Type 1 tyrosinemia is the most common and serious forms, mainly affecting the liver and kidney. First off, type 1 tyrosinemia, the most common and severe form. This type occurs due to a deficiency in the enzyme called fumarate acetoacidase. When this enzyme doesn't work as it should, toxic substances build up in the liver and kidney, which can cause serious damage over time. Patients with a type 1 often experience symptoms early in life, and if untreated, it can lead to a severe liver disease and kidney dysfunctions. Fortunately, with early diagnosis and proper treatments, the severe effects can be managed effectively. Moving on, the type 2 tyrosinemia, which is less common. This type is caused by mutation in the TAT gene, which codes for the enzyme tyrosine amino transferase. This enzyme is crucial for the next step in the breakdown of tyrosine. Type 2, the buildup of tyrosine primarily affects the skin and eyes, leading to issues like painful lesions on the skin and corneal inflammations. Unlike type 1, type 2 doesn't typically affect the liver and kidneys as severely. Lastly, we have type 3 tyrosinemia, which is the rarest form. This type results from a deficiency in the enzyme for hydroxyphenylene pyruvate deoxygenase encoded by the SPD gene. This part of the pathway is also crucial for effectively breaking down tyrosine. Type 3 is particularly interesting because its symptoms can be quite variable, but they often involve neurological issues such as intellectual disability and seizures. Although it is the least common, understanding type 3 important for providing comprehensive care and support of those affected. So, how exactly do doctors figure out if someone has a tyrosinemia? Let's explore the techniques used to identify these rare yet crucial conditions. In many parts of the world, newborns are routinely screened for tyrosinemia. This is crucial because catching it early can significantly change the outcome for the better. Early detections means early treatments, which can greatly improve a child's health and development. For type 1 tyrosinemia, the most severe form, doctors look for a specific marker in the blood, that is succinyl acetone. This substance isn't normally found in the blood, so its presence is a stronger indicator that something is not right. As for type 2 and type 3, these forms are usually diagnosed through genetic screening. This involves analyzing the patient's DNA for specific mutations known as cause those type of tyrosinemia. Genetic tests are incredibly helpful not only for diagnosis tyrosinemia but also for family planning. Families with a history of tyrosinemia may genetic counseling to assess their risk and discuss potential preventive measures. Now, let's talk about how tyrosinemia is treated. It is important to note that while these conditions can be serious, the treatment available today are quite effective, especially when started early. Starting with the type 1 tyrosinemia, the primary treatment is a drug called nitisinone. Nitisinone works by blocking a specific part of the tyrosine's breakdown process, preventing the formation of harmful substances that damage the liver and kidneys. Patients taking nitisinees need to follow a specific low protein diets. Why? Because it reduces the amount of tyrosines and phenylalanines, two amino acids present in protein-rich foods that enter the body, helping to manage the conditions effectively. These combinations of nitisinone and dietary managements can lead to significant improvements. Many children diagnosed early and treated effectively grow up to lead normal, healthy lives, which is a huge with a world of metabolic disorders. For type 2 and type 3 tyrosinemia, the treatment approach is a bit different since these types do not usually result in a liver and kidney damage like type 1. Treatment mainly focuses to manage the symptoms. In type 2, where excess tyrosine leads to skin and eye problems, treatment may include skin creams or ointments to relieve pain and inflammations, and eye drops for corneal issues. Adjusting the diet to control tyrosine level is also crucial. Type 3 is a rarest and treatment is highly individualized, often focusing on managing neurological symptoms. This might involve meditations to control seizures or special educational and developmental interventions to help with learning disabilities. Regular checkup, blood tests, and dietary adjustments are part of the life for those managing tyrosinemia. But with the right support, the outlook is positive. Finally, that a quick look at tyrosinemia. It is a rare condition, but understanding it can make a huge difference for those affected. Remember, knowledge is a power. Thanks for joining me today. If you learned something new, please give us a thumbs up and subscribe for a more clear, easy to understand explanations for more topics. See you next time. Thank you.